Welcome to The Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Graper Harper Cosmetic Surgery in Charlotte, North Carolina, The Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper, Dr. Robert Graper, and Dr. Evon Zoog, also known as The Doc Dudes.
Welcome to yet another episode of The Doc Dudes.
Hotly anticipated.
The discussion for this podcast is weight loss, titled The Wait is Over, Cosmetic Surgery Solutions After Weight Loss, which is a huge topic, and no pun intended, because we do a ton of weight loss surgery here, and I love it. And I have told people for as long as they'll listen, the massive weight loss patient population is one of my favorite. They are dedicated. Mm-hmm. They are educated. They are ambitious. They're hungry for change. They've done all the hard work.
Yeah. They have appropriate expectations,
which is amazing.
too.
That's right. And they do. And so we're going to talk about kind of all things from a weight loss standpoint, how to time it right, what we want you to do, what we don't want you to do, and all those things. So the first thing that I'm going to say is I get patients all the time that come in and say, I can't lose any more weight. I've tried everything. It's harder for some people to lose weight than others.
It's hard for everybody
I get
to
it.
lose weight.
Right. And you may be trying all the things that you tried in the past that worked, or that your friends have tried that have worked, or that your personal trainer or nutritionist tells all their clients to do and it works. But ultimately, weight loss is highly specific, right? And so we try to get people into the hands of individuals that can give them their proper prescription, right? It's like if we want to get strong, the three of us can't do the exact same exercises and expect the same result from it. You know what I mean? Our bodies are just different. Our metabolism is different. And so I encourage people to enlist the help of professionals. There are some great weight loss doctors here in town. There are some wonderful personal trainers. And for a lot of people, I want them to know that if you're listening, doing it on your own is extremely difficult. And so letting somebody who can check your labs, make sure your hormones and all those things are where they need to be in order for you to get the best result from whatever plan you take is crazy important.
Full medical evaluation.
Full medical evaluation. So
diagnosis and treatment.
Right. And so massive weight loss in patients kind of comes from...
Which is defined as?
Great question. So it's typically different depending upon what your height and weight is, right? I mean, people will say it's greater than 50 pounds, or it's greater than 75
or BMI
pounds,
change.
Or it's greater than 100, or it's some sort of BMI, which I'm not a huge fan of, right? BMI is a little outdated, and I think people, if you looked at...
I'm obese with my BMI.
Oh, yeah. I could, if I gained 5 pounds, I'm obese. I could lose 50 and I'd still be healthy. If I lost 50 pounds, it would not be good. Correct. So I tell patients not to necessarily go on that, but people realize when they're out of shape. They know what their fighting weight should be, right? And for boxers or wrestlers' terminology, they know where they should be. And sometimes they just don't know how to get there. But we used to see a ton of patients who had bariatric surgery, which is a couple of different surgeries. So, Evan, talk about maybe the 2 or 3 most popular bariatric surgeries. And these are designed for patients who have a ton of weight to lose. This is not somebody who needs to lose 30 pounds. I mean, bariatric surgery is designed when you watch television shows like My 600-Pound Life and things like that. That is who bariatric surgery is designed for. So there's gastric bypasses, there's, all sorts of different kind of surgical
lap bands.
Yeah, lap bands, all those.
Roux-en-Y.
So right. So Evan, what are a couple of those that we see patients who have had bariatric surgery?
The most common things we see are either a sleeve gastrectomy, where they remove a large portion of the stomach, or a bypass, where they bypass the stomach to the small intestine.
Right.
So those are the two most common things.
And they're often defined as either a restrictive surgery or an absorptive surgery, right? So if we make your stomach, if the bariatric surgeon makes, and I think all three of us have done these surgeries because we're all general surgery trained before plastics. If we make your stomach smaller, you're going to feel full faster, right? And so it's going to restrict the amount of food intake you can have. But if you do one of these Roux-en-Ys, one of these bypasses, where we are emptying your stomach way down your intestine tract, not at the beginning, then that's more of an absorptive thing. And for a long time, the Roux-en-Y gastric bypass was like the gold standard. And I think they're doing less and less of those. I think the absorptive thing has become an issue. And I think that they're realizing that the sleeve gastrectomy, which in its own merit, your stomach can re-expand. And so you can lose some of the benefit from having your stomach reduced in size. But those were the traditional surgeries that we saw, and these patients lose hundreds of pounds.
And things are changing.
And things are changing.
Now we're going to these
injections
GLP-1s.
and pills. That's exactly right. So that leads us to kind of talk about what is out there nowadays, right? We used to kind of talk about patients that were on phentermine.
Phentermine and phentermine.
Yep, and that was a huge one.
Fen-phen.
That people were on fen-phen and medications
Adderall.
that kind of boosted their metabolism and kind of made them feel wired all the time. And that has its positives and negatives as well, right? We now have a new class of drugs, and it's the semaglutides. And so these are the Ozempics, the Wegovy's, the Mounjaros, the Zepbounds, all these things. And I have a little personal experience with that I'm more than happy to share. But let's talk about kind of what it's doing for our patient population right now.
Makes them better candidates for surgery.
It does. And I can say that, the patient that used to come to me that wanted a tummy tuck that was 30, 40 pounds overweight and said that they tried everything. If I said, okay, well, we've got to get you to lose weight, so let's bring you back in 3 months and get you on the scale and see where you are, failed miserably, right? It just rarely worked out where they came and they had lost weight and then, or they went somewhere else.
And had their complications.
Or, maybe they did well. And I hope that they did well, but probably had a complication. But what I'm seeing now, these patients that need to lose 30, 40 pounds, they're getting it done. And it's amazing. And we were just talking kind of before we started recording the podcast that, you're going to read that there are complications for every medicine under the sun. Graper joked around that somebody somewhere has died from drinking too much milk. And you're right. But all in all, Evan, you kind of talked about all the benefits that people are seeing from a cardiovascular, obviously from a diabetic, from a kidney preserving standpoint, that these medications are they're here to stay, and potentially they're here to kind of change
I hope so.
Change the shape of America.
Epidemic.
Yeah, huge.
We're the fattest country in the world, aren't we? But I want to know. So why? So patients ask me. They ask me why. Why do I need to lose weight? Why can't we just cut it out? Why can't we just liposuction it? So why does that matter? A patient who is healthy and fit and has minimal fat and just excess skin is the best patient for us.
Right. It's going to.
And we're talking about massive weight loss.
Right. We're going to increase your chances of having complications like wound healing and infections and all those things. The thicker these flaps, the more fat you have. Fat is not well vascularized.
And what you're saying is exactly right. And for the people who haven't done the anatomy and physiology, if you put on 50 pounds, the same blood supply that was feeding you at a normal body weight now has to feed 50 pounds more of tissue with the same oxygen, and it doesn't heal well when you then cut into it. And both of you doing tummy tucks, there is so much more fat inside the abdomen that's pushing out on your external, when you're doing a tummy tuck, you're taking out a wedge of skin and fat. and that wedge might be 6 inches tall.
Right.
But there's a bunch of fat on the inside of the abdomen that's pushing out in the muscles. So your skin envelope may be tighter when you're done, but you've still got this big abdominal mass that they're different but not really better. Whereas with Ozempic or whatever, you've lost that weight. Now you can, and the analogy I use all the time is the water balloon. If you got a water balloon that's 50% full, you can squeeze it in the center and you narrow that waist up, and now you got the 38, 22, 38 old dimensions. Yeah. But now you've got somebody who's 50 pounds, 70 pounds, 125 pounds overweight. You squeeze that water balloon, nothing changes.
Well, there's some patients that I can't bring your muscles together.
Right.
You have too much intra-abdominal fat. You would bust these stitches in the recovery room and you would be bleeding like crazy. So
it's happened.
And so it's just not worth it. And so it's important to get to a healthy weight. What I also tell people is I don't want you going on a split pea soup diet to starve yourself, because it's also important to be able to make protein and to be able to heal these incisions. And so we need a patient healthy. We need all their parameters doing well. And a lot of that is nutrition. Do I need you to be able to bench press 300 pounds before we do your tummy tuck? No, that's not where the bar is set for your healthiness. We want to make sure for you, for every individual, there's not a weight that we look at, right? I mean, just like our surgeries are designed for the patient specifically, so is their health standard that would be optimal to operate on. There's no doubt about it. So I wanted to lose 15, 20 pounds. Felt like I had kind of let myself go, wasn't working out like I used to. I wanted to try out the Mounjaro and kind of see what it was. And from what I had read, it sounded like Mounjaro was the GLP-1 that was best for weight loss. I also have a little diabetes in my family. And so I just felt like this would be kind of something good to try, and had an awesome experience with it. I mean, I did it for just 3 months, 4 months. I never increased my dosage. I just kind of stayed right where I was, but, lost, I think, like 18 pounds. And then have not been on it for the last, 6 weeks or so. I think I've gained like 5 of it back. So, that's what a lot of people ask. And that's common.
It makes sense.
It's common. And so what happens when you take these medications, and I speak from experience, is you just aren't hungry. And it's really wild. I mean, you really just don't have that same drive to eat. I used to think that there'd be a placebo effect, right? Like whenever we see Cool Sculpting or liposuction or some other company do before and afters, and the patients always look better. I'm like, yeah, but they're in the part of a study. I'm sure all parts of their life is healthier now. So how do we know it's this one thing? Well, when you take that shot, it doesn't take but a day or two before, you're in here, and instead of watching you guys chomp down those peanut butter pretzel pillows in front of me, like you continue to do, you just don't want them. And so you eat less, you are fuller quicker. One of the things that it does is it delays your gastric emptying.
So, can I interrupt you?
Yeah, yeah.
I'm curious, is that satiety, do you feel like it's coming from your abdomen because your abdomen feels full and you're like, I couldn't eat anymore? Or do you think it's coming from your head, like, my tummy's fine, it doesn't appeal to me?
Well, we know, right, that there has to be some sort of loop back mechanism from our intestines, from our stomach to our brain that tells us, yo, you're hungry, you need to eat. If it was just solely in our stomach, we wouldn't feel that urge, right? And so urges don't come from our stomach, they come from our brain. And so there's no doubt that it's in your brain. It's just not being stimulated to eat like it was before. Now, I do think that the delay in gastric emptying, that like it takes you longer to rid your stomach of the food that you put in it is also one of these things that
because everybody's had Thanksgiving dinner and it's like, this tastes so good, but I'm so full, and yet I go eat some more.
So the most interesting thing to me about these drugs is the effect on the brain.
Yeah.
And the hormones.
Yeah.
Because I tried it for 2 weeks, and I tried Ozempic, and the smallest dose, just started it because I wanted to get a little leaner.
Right.
But the most interesting thing was the effect on the brain. I did not have those. I mean, y'all see me every day. I eat a ton of food. It's mostly healthy food, protein. I like my peanut butter pretzels, but I'm always eating. And
who's buying them? You're the one who's buying them.
I didn't feel the brain, like I was not hungry. I didn't feel like I needed to eat something.
Yeah.
It was that's the most interesting thing to me about this.
Yeah,
these
it's
drugs.
wild. And then you also get the feedback from when you come to work or you're at home or you're with your friends and they're like, holy crap, you're losing a ton of weight. And so that's always positive reinforcement, right? It's never good if you're eating healthy, exercising, and you see nothing changing on this scale or you see nothing changing in the mirror. That is awful. But for patients that are on these medications, we do tell them to stop them 3 weeks prior to surgery. And we have them stop it because we want it out of their system, not so that they gain some weight back or anything like that, but we want their gastric motility to go back to normal so that they don't risk, throwing up when they get intubated or anything like that. So it is important that you come off of these medications prior to surgery. But, I can't think of anybody that's not a good candidate for these. And I think that this is going to revolutionize weight loss therapy in America and in the world. And I hope that they can manufacture this at a rate to where it's affordable for people, right? Because we know for a fact that lower socioeconomic people have a higher obesity rate. They just do. And they can't eat healthier foods, which are more expensive than crappy foods. And we just know that. All the statistics show that. So hopefully they will get these medications out to everyone that needs them and can benefit from them, because a healthier, slimmer population is going to just be a better society.
Well, they're
and lower healthcare costs.
Hip replacement issues, knee replacement
heart
issues,
attacks,
less heart attacks,
strokes,
less stroke,
getting your foot chopped off because you got bad diabetes and you haven't controlled your blood sugars for forever. And there's just so many benefits.
What if it makes your alcohol consumption go down?
Right.
I mean, that's a good thing. What if it makes, your gambling addiction? I don't know, maybe they can engineer this drug where the satiety center for gambling is affected.
Yeah.
This is really interesting stuff.
Yeah, it is. And this is here to stay. It's a wonderful medication. Speak to your doctors about it. And I recommend you talking to somebody who's an expert in this, right? Who's taken time to learn about this. There's so many pop-up shops around, right? There's so many med spas that have nobody that knows anything about other disease processes that you may have, that other medications that may counteract poorly with these things. It's like everybody out there wants to just kind of open up a shop for an Ozempic shop so that they can get you to come to their place and make a ton of money, which is not how
it's not our style.
That's not our style, and that's not how these medications should be done.
We want you to be healthy and a better surgical candidate,
right?
And have your whole body evaluate your chemistries, your everything, so that you get the right drug at the right dose for the right time.
But it's the new hot topic, and it's the new kind of wow factor. And there's so many people that are, because doctors can get this compounded for them. Which is fine. It's great. But if doctors that work in metabolism and endocrinology and weight loss are the ones that are prescribing this, it's safe and awesome. Yeah, more power to you. If it's some
plastic surgeon who's just trying to make you a better candidate and they put you on it and they don't know what they're doing, they don't know the side effects.
Right.
And that's like them doing a tummy tuck.
Right.
The endocrinologist doing a tummy tuck, which would be a disaster. Us as plastic surgeons, unless we are highly trained, would be a disaster just writing a prescription and seeing what happens.
Agreed. And so, briefly, let's kind of chat a little bit about the surgeries after massive weight loss, because we do a ton of them. Evan, what are the more common surgeries you're seeing in patients who have lost a ton of weight, now have loose skin?
Typically, these patients will need a male or female tummy tuck, and it's typically a circumferential tummy tuck.
Yeah, that means all the way around.
All the way around to the back. Yeah. It's essentially a body lift. Many of them will need, for females, a breast lift, or for males, removing that excess skin. And then arms and legs are also very common with these patients. But, I've operated on patients who have been able to get to a goal weight and have their surgery through gastric surgery, gastric bypass, or a sleeve, or medications, or patients who have just done this through diet and exercise.
Right, which is amazing.
Which patients are going to have a better result? It's going to be the patients who did it through diet and exercise.
Sure.
Because they're eating healthy, they're getting enough protein, so they can heal things.
There's not a restrictive or absorptive issue.
Exactly.
They've just changed their lifestyle.
So, I know it's very difficult. I'm in the snack cabinet every night.
Yeah.
Eating some chips or whatever. But if you can do that, that is the best way to do it.
100%.
The best way.
And it's also the timing of things, right? You want patients to lose weight prior to surgery. And we can't stress that enough, that we would rather you lose the weight first. I mean, there are some patients where a surgery is necessary in order for them to kind of reach that next milestone of healthiness, right? I mean, there's some people who literally can't exercise because maybe their breasts are too huge, or their stomach pannus, the excess skin, or their leg skin or their arm skin is in the way of them being able to exercise. So for those people, sometimes plastic surgery is this kind of link in this bridge to a healthier lifestyle on the other side.
It is. A lot of this is psychological.
That's exactly right.
I mean, one of my favorite patients, she had a breast lift, and she was so happy and motivated from her results. She lost like 30 pounds, and then we did her tummy, and she looks freaking awesome.
I know. Those are great. And I love those patients as well. Dr. Graper and I saw a patient of yours today who's lost, 200 pounds, and the guy's just over the moon.
What he used to eat for breakfast was shocking.
Shocking.
I mean, so much it would have been more than most people would eat in a whole day.
The calorie consumption, but that's how it happens. But it's also one of these things where it's like their metabolism changes. When you find somebody who gains 80 pounds in a year, gains, not loses 80 pounds in a year, that their hormones and their metabolism and all that has gone awry. Like, there's not enough. You can't just eat those calories. Like, there's something going on with your body.
Yeah, for sure.
So, right. So I typically tell patients that have lost a ton of weight, I like to set the torso first, right? So I like to do their abdomen, breast, chest, that area before going on and doing things like thigh lifts or brachioplasties or mid-back lifts or things like that. Now, there are things that we can do to prepare a patient for those surgeries. If they've deflated everywhere but still have some thickness to their arms, then I'll tell them, well, let's do your torso, let's do your chest, and let's liposuction your arms so that skin can start to retract back up, hopefully a little bit, thicken up a little bit so that it has a better chance to heal and has better perfusion and those things. So, but at that point, their feet are kind of taped to the bicycle. Once you've liposuctioned their legs or their arms, they may be flabbier than they were when they had that kind of filler. It's like, pillow stuffing, right? And so if you take that stuffing out, then they can be looser, and that's never positive for somebody. So I tell them, this is temporary. Once we remove the skin, everything's going to look a whole lot better, which is great. Well, I need more than one surgery after my weight loss, which obviously is per patient. But in a typical massive weight loss patient, Evan, is it one and done for them?
No.
Okay.
I tell all my patients when I see them, typically these surgeries are staged. I want their surgery to be less than 6 hours. So if I can't get everything done in 6 hours, then I'm going to want to stage it. And I also tell them that there's up to a 50% chance of needing a revision after massive weight loss surgery.
Yeah, absolutely.
So I make that very clear.
Yeah.
That there's going to be some things that we need to touch up on.
And, Dr. Graper, you do the lion's share of facelifts, neck lifts, eyelid surgeries, that kind of stuff here at the practice. So are you seeing massive weight loss patients that would benefit from those surgeries? And is there anything different about them than anybody else that needs a neck lift or facelift or eyelid surgery?
There are a lot of massive weight loss patients that need now facelifts, neck lifts. It's not so much eyes that is affected by weight or brows or noses, but the faces, they get very round, and they're not good candidates because the fat gets thicker between the muscle groups that run maybe perpendicular to each other in the face to smile or pucker or whatever their function is. And as those fat layers get thinner, you're able to tighten the face up, much like the water balloon thing or the waist.
Sure.
So they get a much better result when they're thinner than when they're heavy. And after they've lost the weight, they're just like everybody else.
Yeah.
And they get a standard good result versus somebody who comes in 30 pounds or more overweight.
Right. So I think what we want is we want listeners to know that while we may think that you've tried everything and you're frustrated, and that is a natural response to plateauing and not seeing the results that you want after hard work, getting help from people who are experts in this is critical and will improve your success rate in losing weight exponentially. And so there are people out there who do this all day and are experts in this and can help guide you. So you are not stuck at this weight. You have not tried everything. If all else fails, yes, send in your application for Survivor or Naked and Afraid, and you will lose weight, I promise. When you've lost that weight and you're healthy and you're eating protein and your blood pressure is under better control and your blood sugars are under better control and your body is not where you want it because you have excess skin, know that that's where we come in to play. And that's where we can improve every single part of your body, right? I mean, from head to toe, there are areas that are affected by massive weight loss. And so we want you to come in and prioritize for us what bothers you the most and what you want changed the most. And then we'll come up with a safe, smart plan to get you to the best version of you that we can.
Because diet and exercise are critical for losing fat, but they don't ever shrink stretched out skin.
That's right.
And they don't tighten loose muscles.
That's right.
So when you've done all you can do, congratulations. That's hugely helpful.
Absolutely.
But there are things you can't do.
Yeah. If you have any other questions or topics you want us to cover, please visit www.ghsurgery.com. Click on the Doc Dudes. That's who you're listening to right now from the homepage. There's a link to click to submit your questions and ideas. You can also listen to all of the Doc Dudes episodes in our website, as well as Apple, Spotify, YouTube, or anywhere else that you may listen to your favorite podcasts. Follow us on Instagram and Facebook to find out what new episodes drop and other information about our practice. I don't even think that we introduced ourselves at the beginning, not that we need to anymore, but I'm Garrett Harper.
Robert Graper.
Evon Zoog.
We're signing out.
Man.
We're signing out.
Zoogski.
Zoogmeister.
Zoogstein.
It's my Twitter handle.
See you guys.